Nia is expecting a baby. During the first 10 weeks of her pregnancy, Nia will be offered 8 screening tests by her midwife to check for health conditions in her or her baby. Screening is your choice. Nia can choose which tests, if any, she wants. Screening tests can help to detect some of the conditions Nia or her baby may have. They do not show for certain whether Nia or her baby has the condition screened for. The tests offered include blood tests and ultrasound scans. Sometimes the blood test or ultrasound scan can give an unclear result, and further tests may be needed. It can be difficult to decide what tests to have. To help Nia make her decision, she can read the information and watch the short animations on the Public Health Wales website. Nia can also talk about the tests with her midwife and ask any questions she may have. If Nia has type 1 or type 2 diabetes, she will be offered eye screening during her pregnancy. Towards the end of her pregnancy, a midwife will discuss the screening offered for her newborn baby, so she knows what to expect. A hearing test will be offered in the hospital or at a local clinic. A midwife will offer a blood spot, heel prick test when Nia's baby is around 5 days old. This involves taking a few drops of blood from her baby's heel. The blood spot heel prick test screens for 9 rare but serious conditions. Newborn blood spot screening for all of the conditions is recommended by the NHS. Screening is your choice. Information about pregnancy and newborn screening can help you make the right choice for you and your baby. For more information or support, speak to a midwife or doctor.